Hi, how's it going? If you're new here, this is Tenzin. I'm one of the resis from Canberra, Australia. Today I'm going to discuss about how to prepare and how to stand out in the interview in the Australian healthcare system. Of course, to reach at the interview stage, you should have an AMC 1 and or AMC2 result, an English result ideally, and you should have a good CV and a good cover letter. For the CV and the cover letter, I have made a detailed video, and I'll put the video in the link in the description down below. First of all, if you have reached up to the interview stage, congratulations. That's a big step for an IMG and a one step closer to your first dream job in Australia. Like every examination, interview also needs its own preparation, but definitely this is less intense than the exams, especially AMC clinical examination. The art is when you're applying for the RMO or the resident medical officer jobs in Australia, what the Australian healthcare system wants is that you should first be a safe doctor. The second thing is you should be able to do the basic history examination, organizing basic investigations. You should be able to have basic skill of interpreting the investigations, and you should be able to escalate the case at an appropriate time to the consultant or to the registrar. All right, the biggest tip to any IMG is that when you are in your interview, don't think like an IMG. All right. What I mean by that is most of the IMGs, we tend to solve most of the cases by our own. We take the most important decisions in regards to the patient, and then we discuss with a specialist. It does not happen that way in Australia. So in Australia, if there is an important thing that needs to be discussed, it has to be discussed immediately with the registrars first. If the registrars are not available, then the consultant. This is called escalation of the case. All right. And you are not the only doctor who is involved in the major decision making thing. You have to appear as someone who is fitter to the Australian healthcare system rather than as someone who is highly skilled and who takes all the decisions by yourself. So, this may be considered as an unsafe doctor. All right. The interview setup. So in the interview, there will be one admin person who will be the moderator. There will be two or three doctors from different specialities generally, one from medicine or one from emergency medicine and one from the surgical specialty. All right. Now, what will happen during the interview? First things first, of course, they will introduce themselves. And for example, my name is Tenzin Wangchuk. So, most of the consultants or the doctors in Australia like to be called by their first name. It's a very how should I say, it's a very common thing to call anyone or any doctor with their first name and not say Dr. XYZ. For example, so my first name is Tenzin. So everyone generally likes to be called as Tenzin. So let's imagine that I'm one of the interviewers. So I can say, for example, if your name is, let's say, Amit, so I can say, hi, Amit, this is Tenzin, one of the consultants from XYZ department. What I would ideally do is when they introduce themselves, I keep a pen and a paper. You're allowed to keep that. I make a note of their names, and sometimes their names will appear in the Microsoft Teams section or in the Zoom section. Sometimes, if it doesn't appear, now if you remember their name, if Someone introduces themselves as Tenzin with their first name and not call themselves as Dr. Tenzin or Dr. Wangchuk, so you should also respond to that person with the name that they have called. So when you are answering the question, let's say, for example, you just say like, thank you, Tenzin, for this question. So I would do this, this, and this as an answer. You're not gonna say thank you, Dr. Tenzin, or thank you, Dr. Tenzin Wangchuk. That sounds very odd as per the hospitals here. So, in Australia, even an intern or the most junior doctor calls with the first name to the senior most doctor or the consultant. Now, some doctors or some consultants like to be called as doctor and surname. So, for example, some like to be called as Dr. Wangchuk. So, for such person, you are gonna say Dr. Wangchuk, and you're not gonna say, "Hey Tenzin." All right. So keep a note on how they introduce themselves, and you can call like you can use the same way to call them when you are answering the question. Now, this is one of the key things I feel that for you to be or to appear fitter to the Australian healthcare system rather than appearing as an IMG and not so fit for the particular interview. Now, in terms of your interview preparation book, there is a book called ST Interview Guide. It is an interview preparation group based on NHS, but this can be absolutely true for the Australian healthcare system as well. I can't like emphasize more on how amazing this book is. This book has all the examples of the type of questions and how you should answer them, how you should frame the answers, and you can even tell the exact answers of what's there in the book and just say it as your own. Um, so that's the book, and you don't have to read the whole book. You only have to read few chapters. I will make sure that I'll write the names of the chapters down below where you have those that you have to read rather than whole book. Now, you're definitely not going to ask me where to get the link of the book because yeah, that's not legal for me to say that on the internet. All right. So the interview will be generally just 20 to 30 minutes. It won't be long. There'll be one personal questions, for example, to introduce yourself or in regards to the interests or hobbies that you have mentioned in your CV or in regards to a particular achievement that you have mentioned in your CV. That'll be your personal question. Two clinical questions, generally one medicine or one emergency medicine question, and one surgical question. Now, in the medical question can also include pediatric questions, and the surgical questions can also include like gen surge, orthopedics, obstetrics, like yeah, generally those. And one questions based on your ethics, we call it as ethical question. One question based on your communication skill. So that's the general layout of the interview. So let's start with the first question. The sure shot 100% they're going to ask is, can you introduce yourself to the panel, Tenzin? So when you are introducing yourself, you don't necessarily have to just say what your name is, where you are from, where you're practicing, and how many years of clinical experience you have. Now, the panel wants to know something more than that. And in the book, there is a format called CAMP, clinical, academic, management, and personal. Now, when you are introducing yourself, of course, you have to say all the things that I have mentioned. And on top of that, you also have to mention about your clinical skills and competencies, your academic skills and competencies, your management skills, which includes your leadership experience, and the personal, which includes your interests or your hobbies, your ethical values, and so on. And make sure that you keep your answers within 1.5 to 2 minutes. Never introduce yourself as Dr. XYZ. So, this is very weird and very odd, I should say, to someone who is working in Australia. So you always introduce yourself with your first name, all right? You're always going to say, "Hi, I'm Tenzin." You're not going to say, "Hi, I'm Dr. Tenzin." And when you say that, you become the odd person in the room. All right, so let's practice an introduction section. You can say something like, "Hi, I'm Tenzin. I'm one of the junior doctors working in XYZ hospital in India, and I have 3 years of clinical experience here working as a junior doctor as a rotational post. I have completed my MBBS from XYZ Medical College in the year 2020, and I've just completed my AMC2 clinical examination, and I'll be very happy if I can become a part of your team. I'm competent in taking history, performing physical examinations, organizing investigations, and interpreting them, and also at the same time escalating the cases to the registrars or the consultants when needed. I'm very enthusiastic in research and audits, and I'm amazed to see how the hospital is so well supported for the research. My colleagues also tell me that I have a good leadership skill, and this has been quite significant during the time of COVID 19 when there was a severe shortage of staff. I made sure that the workplace was well organized and the tasks were delegated among the staffs, and the well being of both the patients as well as the staffs were kept priority. In terms of my personal life after work, I love to do content creation in social media on the wellness of doctors, and this is something I really enjoy. And I'm someone who believes that there's a very important need of having a work-life balance, and this is just not just for the personal life but also for the professional life as well, to become more productive at the workplace. Thank you so much. Something like that. This is just a small story that I've just created to give you an example of how I went through the clinical, academic, management, and the personal format, the CAM format, during the introduction.